Ladies, if you're in your 30s, 40s, or even your 50s and you're wondering about hormones, this is the episode for you. Welcome to Elevate and Thrive. It's your host, Perry Napier. I'm here with Dr. Angela, Dr. Samantha making her debut on the podcast.
Woohoo!
What's up?
Samantha.
Welcome.
Dr. Samantha.
And today we're talking about hormones. So this is definitely for hormones specifically here around perimenopause, menopause. So this one's definitely for the ladies.
It's absolutely for the ladies. Yeah, there is actually an andropause, but we're not quite getting into that where men start to experience lower testosterone. So that should be a future one. But yes, so what basically we're dealing with when we're talking about perimenopause or menopause is just perimenopause is a slow decline of the hormones that are coming from the ovaries. And menopause is also known as ovarian failure. So essentially the ovaries just stop making the hormones completely. So it's gone at that point. So, you know, many women start to experience, I would say, uncomfortable feelings and symptoms starting in that perimenopausal time when the hormones are starting to decline, right?
Mm-hmm. Typically around 45 to 50 is where we'll start to see more of those symptoms come up. But it can start as early as in your 40s as well.
Absolutely. I even have people who are late 30s because the average age of menopause is 53, right? So that means there are going to be women. I have a woman who's still having a period and she's 60, right? So that's the rare outlier. But I mean, really, most women, as you said, are going to start, you know, and we'll talk about those symptoms. You know, it starts around like mid 40s, and then, you know, definitely.
I have a question on that. Is it guaranteed that you're going to go through?
That is a great question.
You know, because I often and I bring this up because I had a friend who just the other day was talking. She's going through like a cut on her calories, losing weight, like kind of a health focus, and she felt like, you know, man, it seems like it's much harder this time for whatever reason. And she started to think maybe I'm in perimenopause, right? She started kind of going through the list of all the stuff. And, you know, I said, you know, you very well could be. But that led me to this thought, like, does everybody go through it?
That's a great question. I mean, yes, eventually for all women, their ovaries are going to fail. Like, it's going to happen if they live long enough. But, I mean, is every single woman going to go through symptoms? No. Actually, there are women who kind of just sail right through it. Those are the lucky ones, and they don't have any hot flashes or night sweats or really, you know, significant change in their metabolism, things like that. But I would say those are probably the lucky few that get to avoid it. Most women are going to feel something.
So this is good for anybody who's kind of getting into that stage of life where, you know, chances are if you're not experiencing it now, you will experience some or all of these things at some point.
Yes, I would agree.
At some point, yes.
Yeah, at some point. So, yeah. So I would say let's maybe dive into what you could experience.
Yeah, what are those symptoms? Like, what would you be on the lookout for, right? Because I know that a lot of times whenever we have an issue that comes up, you know, we're hitting that WebMD and we're starting to look at like, oh my God, what's going on with my body, right? So what are some of those things that we would be symptomatically looking for maybe?
Perimenopause, really looking at changes in menstruation is going to be a big thing. Libido changes are also a big thing for women. Irritability, insomnia, abnormal bleeding, right? Getting back to that, like, I had my period, it's been 2 weeks, I'm having another period. Like, what is going on with this? Or my cycles are really, really long, you know, 40 plus days, that type of thing. Cognitive changes can be a big thing. Like, I'm having a lot of brain fog. I seem to be forgetting my kids' schedule. I can't remember to pick up the laundry. I forgot to take the dog, XYZ, that type of stuff. Night sweats and hot flashes can come in there too. Sometimes you will see those even earlier, though, if hormones are not refined in like the 30s and such, and they can get worse as you get into that perimenopause type age range.
So you can start to have some like disruption or imbalance in your 30s, and that can cascade then into an even more intense situation as then your body starts to go through some really significant internal changes as well.
It can.
Yeah, and I would agree, and you don't have to have all of those things, right?
No.
You can have a couple of them. You can just have, you know, your period change, or just start feeling hot, or just stop sleeping, or you know,
that's a big one.
It's the stop sleeping is a huge one. or irritability. That might also be part of it. And then all of those things sometimes on steroids when women are actually in menopause.
Right.
Yes.
So perimenopause is kind of the before menopause stage.
Before,
Yeah. So this is like
changes are happening.
Yeah.
Yes.
It's like the trailer to the movie.
Yeah.
And then you're like,
It's not a good. It's not a good.
yeah,
movie.
not a good
It's a scary movie.
Yeah.
It's, I think one thing too with menopause that it has a kind of a negative connotation in society, but I think to get women to realize that they are moving into their wisdom years and this is a beautiful time of life, oftentimes can kind of help them reframe how they are experiencing menopause or perimenopause and look at their body with grace and accept things. And it can oftentimes, right, where the mind goes, the body also follows. It can help to alleviate some of that too. So, right, there is that mind-body connection that plays into this as well.
I love that. Yeah, because I would agree. I mean, I think for some women, it's kind of a time of mourning because you're losing your ability to have babies, and maybe even if you didn't want to have more babies, it's just kind of it's a shift out of a period of your life, So I would agree with you. I think for some women there is. Beyond the symptoms, there's kind of an emotional attachment to reproduction and having a period, things like that. So,
and I think also in people that I've talked to are kind of going through it or similar situations, there's also maybe a feeling of loss of control or of body sabotage or like my body's going haywire. And I find that, in a lot of conversations, that's a really frustrating and kind of challenging feeling and a feeling like, what can I do about this? Maybe a sense of powerlessness or that sense of unwanted change, right? Like this is changing and I don't want these changes to happen.
Yeah, I would agree with that,
Especially as you were talking about some of these menopausal changes, I mean.
It's not super fun.
Urinary incontinence, skin atrophy, hair thinning,
it's
vaginal atrophy.
Yeah,
Nobody signs up for that.
Painful.
Nobody wants that one.
Nobody wants that one. So luckily, given all these symptoms, we have solutions, right?
Well, lots of
and
solutions.
we have a lot of solutions.
I got a big toolbox.
We have a huge toolbox.
And I think that's really the message for the show and kind of one of our kind of points that we make for everyone who comes to see us is that there's hope, there's options.
Absolutely.
Way more than you maybe think. Because, you talked about that for many women, it's a sense of, there's this, it's a kind of a societal menopause. It's like you're less than afterwards, right? And I think we're here to say, no, that's not the case at all. Embrace some of these changes. Some of them you might not want, but a lot of them can be mitigated or can be moved, right? And can be treated effectively to get you to a spot where you're feeling that grace and power.
Yeah, absolutely. I think, right, reframing that shift in that patient to see this as a beautiful time in life, as the moving into elderhood too, right? Obviously not elderhood, but
never use that term for a menopausal woman. She might kill you. Yeah, you're right.
Let's edit that out then.
Into your power years.
Your power years.
Years of gray.
Yeah.
But I do call it, when I do talk to them about like your wisdom years, right? And that just embracing that and that there is respect and there is knowledge within there.
And you can still, and you can still, as we're going to get into with these treatment options, find a lot of ways to help mitigate some of the bigger effects.
Yeah. So, usually we start kind of always at the lowest, many times, depending on, and this might depend on symptom level, but like the lowest intervention, which tends to be, herbal and food, right? And lifestyle changes. So, in talking about our herbs, so whenever we're approaching, any menopausal symptom, we're always thinking of balancing estrogen and progesterone. And progesterone, I would say, is probably more supportive. We think of it for mood, for sleep is amazing. Also, looking at, really balancing the estrogen as well. And then coming into the estrogen, that's your hot flashes, night sweats, your skin plumpness or vitality, vaginal plumpness and elasticity, absolutely, as well as just in memory. So, and cardiovascular support, bone. Gosh, I mean, so there are a lot of reasons that we want to do both. And it might, with that list, might sound like, estrogen is more important, but progesterone is actually very much a risk balancer, right?
Absolutely.
It's going to balance out the potential issues with your estrogen. So, Dr. Samantha, I don't know if you want to talk just briefly about kind of our herbs that we tend to use at first.
So looking at phytoprogesterone, herbs, thinking about chaste tree, which works really with the hypothalamic pituitary ovarian axis, and wild yam, right? So wild yam, we can actually get progesterone and DHEA from, right? So we kind of actually cover two birds with one stone.
Right,
with
so some
that
adrenal support, little testosterone support with the DHEA. Yes.
So I have seen these herbs work wonders in young and older women in helping to balance out kind of that communication from the brain to the ovaries, right? As we're moving into menopause, that brain starts screaming at those ovaries to be putting out hormones, right? And this chaste tree comes in and helps to kind of balance that out. So it's not so much of a scream, but more of a gentle encouragement.
Yes.
Estrogenic herbs, right? I think a lot of times when we think of estrogen in society, we think beer. Well, what's beer? Hops.
Yeah,
so hops comes in and is really helpful with supporting that estrogen metabolism and creation of it. Maca is also very powerful. I've used this in a lot of menopausal females and seen great benefits, especially around the hot flashes and the night sweats that are happening. Black cohosh, I haven't used that one too much.
It's a pretty easy, I would say, intro herb. Like a lot of times it's extremely well tolerated and can work really, really well. Usually, you take a little bit in the morning and it covers things. And then if you take it at night, it covers the night sweats. So a lot of times black cohosh is my first go-to in starting, and then move on to maca or the blends with hops and all the, the other phytoestrogenic herbs. I really like black cohosh, actually. I think it's a good starting place.
Awesome.
And then thinking about lifestyle, we know like anytime we have really, good balance of diet and exercise and weight balance, that's always helpful because it helps the liver, helps the digestive system process and eliminate hormones.
Bringing up smoking, like whether you're smoking nicotine or cannabis, stopping both of those for periods of time, I would encourage you to 100% stop smoking cigarettes. If you can make your own decisions about marijuana, but stopping smoking to take that burden off of the liver, especially around this time of life, because we do need that liver to keep up with processing out those hormones, and those compounds can come in and kind of gunk things up, right? So that's where lifestyle really does come in, and I make a huge plug for women, like, you got to stop smoking.
Yeah. It's great. It's always a great idea.
Yes.
Yeah, it turns out the things that are bad for you are even worse when you're going through these types of things. Yeah, so
who would have thought?
I love that. Baseline stuff, right? Like moving and then also cleaning up the diet, and then of course smoking with its whole host of negative impact is extra negative here when it comes to your hormone balance.
Yes. Yeah. And then we sometimes use, we were talking about SSRIs, like serotonin reuptake inhibitors, and that's one I find I don't normally have to reach for. Would you say sometimes you do?
In my former practice, I actually did use them kind of before women were comfortable going on maybe onto BHRT. We would try other options, and a lot of times actually sertraline would come in at a low dose and be helpful for females, and then once they were able to potentially handle some of that and maybe mentally be okay with moving on to hormone replacement therapy, we'd taper off the SSRI and then move on to the BHRT, and they would be like, oh, I feel really good, actually. And it's like, yeah, this is great. But sometimes we need a little bit of that, not a crutch, but just a little bit of a help.
Additional support.
Yeah, to be able to move in with confidence into the next phase of something. So not my first choice, but it is an option that is there if ever we need it. And naturopathic doctors obviously are licensed and can prescribe and manage these medications. So, I have seen them work.
Yeah, that makes sense. And I would say definitely if there's more, obviously, if there's a mood component, right? Like if there's some depression, anxiety going on with the hormone shift, which absolutely can happen, because it impacts our brain, right?
It absolutely does.
We do recommend acupuncture as well. And then related to diet, many times what we're doing is we're kind of pushing to whole foods and then also some incorporating oils that also help to feed, basically act like, kind of plant estrogens, basically. And so that would be like your hemp seeds and your flax seeds, although flax, I think you have to be kind of careful with, with your omega-6 balance.
Yes.
And then also even just incorporating some of your other oils, because our hormones are, they're made from oil. So if you're kind of starving that area.
Cholesterol backbone.
That's right.
Well, which is interesting, right? Because I think you get a lot of people get into an ultra low fat diet, right?
Yes.
Fat has, still, especially I think right now today, as people are getting in their 40s and 50s and early 60s, they're coming from a generation where fat was the enemy. Even if they've embraced at some point along the way, maybe an Atkins or ketogenic approach, where then they were like hog wild on the fats, we're talking here about the right kinds of fats and the right balance, right? So fat, it's like anything is neither good nor bad. It just depends on the specific kinds of fats we're talking about, your body, your unique snowflake individual metabolism, right? Like, so oil in fats can be very, very beneficial when they're the right kinds and the right balance.
Absolutely. Absolutely. Well, so I would say probably the main thing a lot of women come in to see us for is because they want to talk about hormones, right? They want to talk about hormone replacement. And that's, as you were mentioning, the BHRT is the Bioidentical hormone replacement therapy. And they are, I would say they can be pretty magical.
They are magic.
Yeah. And really taking women back to a place where they feel like themselves, like their old self, and addressing and eliminating these symptoms that they're experiencing,
So which makes total sense, right? I mean, if you came to me and said, hey, listen, you can do all this food lifestyle changes and all these behavioral changes, and then I give you all these herbs, and you can take these seeds, and here's this flax oil, and blah, blah, blah. Or I can just get some bioidentical hormones.
Well,
I would
Barry,
vote for that
we want
every
to do
time.
all of them.
So I was going to say, yeah. So I think, right, the point is like, don't you kind of have to do sometimes some of the lifestyle stuff and to really get some of the benefit from the bioidentical hormone replacement?
Well, you can't.
Or can you just do the bioidentical hormones and just keep smoking those cigarettes and pound those cigars?
Do not come to me then, because that is a risk I'm not willing to take. There was a study done that actually showed that with lifestyle interventions, you can actually use up to 50% less of BHRT or just hormone replacement therapy in general, right? So that lifestyle piece plays a massive part into this, and it plays a big part into safety as well, right? So
yeah,
that could be another
point.
podcast, but we do have to always factor in safety with hormone replacement. So that's something that your physician will always be measuring out to make sure that it's customized and safe for you, not what a standard study says, but what is specific for this patient.
Absolutely. And I would mention also is that I would say our practice style is to get you to a place where you're feeling amazing at the lowest dose possible.
Absolutely.
Because then that risk level or risk factor is
severely
much
mitigated.
Yeah, absolutely. Much, much less. And that is going to be individual, for every single woman. And so, a way that we begin, most times, we understand that, especially in perimenopause, your hormone balance is going to be different woman to woman. Now, if you're in menopause, you have no estrogen, you have no progesterone, you probably have very little testosterone because that's pretty normal anyway. And the markers for showing that your ovaries have failed are high, right? So they're FSH and LH. So many times we do measurements only to get like a baseline at that point. And especially if we're manipulating hormones, right? We want to see how much is this changing. I really like to see like the ultra-sensitive estradiol, estrone, which is like a strong estrogen, estriol, the SHBG, sex hormone binding globulin, progesterone, and I do like testosterone as well.
You got to check that.
Yeah. And so when we're thinking about dosing, I would say, and safety, that, I mean, the research around bioidenticals are quite good from a safety perspective.
It really is.
It really is. And I think, especially when we're kind of comparing it to your synthetic hormones, right? And that's where I think when people are going to their standard docs and they're saying, hey, I like hormone replacement therapy, that doc generally is thinking of the synthetics.
Yes.
And they're like, you either don't need to do it, or if you do it, you're going to do it for a year or two because the risk factors are so high, whether it's contributing to an estrogen-based cancer, that's always the highest concern, or clotting risk, right?
No smoking.
And the no smoking, right? And luckily, when we look at the studies, say related to cancer risk related to bioidentical hormones, it's pretty cool. It looks like the weaker estrogens actually can be protective, and the progesterone also is protective of the cells. So now, I mean, would we do it if somebody has a strong family history, of cancer? No, we're not going to do it, So yeah, I mean, I think it's just really coming in and approaching people from
where they are,
what
their family history is, what their goals are. What are they comfortable with? What are you as a physician comfortable with? Is this patient compliant with testing and following up with certain things, right? Those are all things as a physician that we have to take into account. But I've seen hormones do amazing things, especially in gals that have something like PMDD, right? Where we're spanning a lifespan of when these hormones are fluctuating.
So it's like, we're looking at like a PMS type situation.
Yes. Sorry.
Yeah.
People are familiar with that. Forgot about that.
Yeah. So to kind of tie it up with a bow here, basically what we're saying is that as you're going through these changes, there's a variety of options that you have. Part of it is lifestyle based, which we would do regardless of what other interventions we would be looking
Absolutely.
at. Lifestyle, as we always know, is huge, and it's great to have a team to support you in making those changes because we know they're very challenging to make, and there's a lot of options, right? So part of it is getting the right guidance and understanding around here's the lifestyle issues that are affecting you. Here's how we're going to change them. Then it comes into looking at that individual, their history and all that to determine if we're going to look at some kind of hormone replacement therapy, then what would that look like for them so that it's safe and effective, and we're putting them on a process that can be long-term and sustainable for them.
Absolutely. Yeah.
And the way to get there, right? And that's what we do. That's what makes us special, right? That's different than when you go to your a regular, maybe conventional doc, where it's going to be a lot less comprehensive. And to your point, maybe looking at some synthetic style hormones that we wouldn't use, and that for most people, there is some risk factor there. So that's why we say, it takes a team, it takes a village, and that's what we're here to help you do, is figure these things out.
Yeah, I would say, yeah, absolutely. There's no reason. What I would say is that if you're suffering, there is no reason for you to be suffering.
No.
It's like, come in, we will take care of you.
This is because this is one of those things I feel like a person could live with for a long period of time, and then they're in this really dark place, and then it's like, then they go get help. Well, go get help when you're in the beginning stages where you're like, something's not right.
I always tell my patients it's better to stop the trail from derailing than it is to get that train back on.
Totally.
So, yeah, absolutely. Come in for help. Ask your friends what they've done to you. What doctor have they seen, right? Get that name and number.
Or just come see us, if you're listening to this podcast. Yeah.
Yeah, if you're local, come in. Yeah, otherwise go find a doctor who's talking this talk. Yeah. Pull some of this language in. This is really what it comes to when it comes to creating a lasting solution for you to get you into a better place. Know that there's a path for you. We're here to help if you need it. And Dr. Samantha, it's been awesome having you on the show.
Yeah,
thanks.
It's great.
Thanks
Great first podcast. Absolutely.
I'll get better.
Awesome. Well, we will catch y'all on the next episode. Until then, remember, it's time to elevate and thrive.
Bye.
Bye.